The opioid crisis is a large problem that continues to grow. It affects people of all ages and demographics. Per Cincinnati.com, in the article that was published back in April of this year, the federal government is cracking down on physicians and the number of opioids prescribed. Earlier this year in the Appalachia, that includes Kentucky, there were as many as 60 physicians and pharmacists charged with giving illegal prescriptions that put as many as 32 million pills in the hands of patients. Some of these doctors were accused of trading drugs for sex, giving prescriptions to Facebook friends, and giving medications without even doing proper medical examinations. At least 5 of those patients died. The federal government stated that they're trying to crack down on clinics that prescribe opioids unnecessarily or without even doing a physical exam. Some doctors are also accused of leaving a prescription pad in the hands of office staff and just leaving them to fill out the blanks. And others would charge a concierge fee of $60 to $600 per prescription, or just handing out pills for cash. In small rural areas, this can wreak havoc on the town. And about 80% of the people that misuse heroin misuse prescription drugs first, so it's a gateway drug. Some people were even given treatments that they didn't need in order to get prescriptions filled. So as you can see, this is a problem on both the prescriber side and in the community as well. A lot of people are selling drugs, obviously, and they're relying on their providers and physicians to get the drugs. And if our doctors aren't trying to combat this epidemic, then people are having more access to these drugs. The opioid crisis has affected my career. I've been a nurse for about 4 years. I didn't really see it too much in the nursing home. We did have some clock watchers, but I wouldn't really call that an opioid addiction. I did see it in the NICU a lot. We would have babies that would come in that were addicted to drugs, and we would have to help them to withdraw. UK actually opened a unit especially for drugs, babies that were born addicted to drugs, and the NACU, it's a neonatal abstinence care unit. It was offer an option for moms that were in the Subutex program to come in and to help care for their baby. They were closely monitored by social work, and they had to meet certain criteria, and they would be monitored by a nurse to make sure that they were fit to care for the babies and to make sure that they were adhering to their program. It's definitely hard to watch tiny humans withdraw from drugs. They have the tremors, they have diarrhea, they're very irritable, they're hard to soothe, and there are some babies that are so small that they cannot be given medication and they have to withdraw on their own, and those are particularly hard to watch. Watch them go through that without being able to give them medication because they're just too small. It affects them on down the road. If their social situation isn't ideal and they're taken away from their families or they're in and out of their home, I see it now in the clinic that I work at. It makes continuity of care very difficult because they could be with mom, or mom could be in jail, or dad could be in jail due to the drug abuse. If they're in and out of jail, you never know who to call. The kids, it can cause psychological issues to the kids because they're constantly in and out of the home. Living with grandparents, it's just not a stable situation, and they're watching their parents relapse or see them high off drugs. It's just not a good situation. It's hard. It's hard on the medical staff. It's hard on the kids. And a lot of these kids have psych issues due to the trauma that they've endured at home, or they even have long-term medical issues from the drug abuse. They don't fully escape unscathed. So for my intervention, I chose yoga because it's non-pharmacological. My targeted audience would be for patients at a pain clinic. I chose this setting because yoga is beneficial because it can not only improve chronic pain, but it can help get people moving. So it can actually be used in both ways, before addiction or even after addiction starts. It can be used as in treatment if a person's already addicted to pain medication, but it can also be used in clinics or as not necessarily a treatment, but as a option for people who are having chronic pain, to help get them moving and help improve their flexibility and help get their blood flow going. Yoga is beneficial because it can not only help improve chronic pain, but it can also help people get moving. It may actually help manage anxiety, PTSD, or clinical depression, which a lot of those can be part of the withdrawal process from being on opioids. Doing yoga can give people the tools to help them feel better and to get moving. My overall goal or outcome is to help educate patients on a non-pharmacological intervention to help manage their chronic pain. Back pain is the number one chronic pain that is prescribed opioids, which, as I just said earlier, opioids can be a gateway drug to heroin. They can't get their high anymore, so they turn to heroin, heavier drugs. I would evaluate my learning objectives were met, if they went to a class or not. If this were placed in a clinic, I have a handout. It's called Yoga for Pain Relief. I just put some important things to know about yoga, some benefits to yoga. I just put that it may be used to help with different types of back pain or different types of pain, such as low back pain, neck pain, headaches, fibromyalgia, and arthritis. And then I said important things to know about yoga is that one yoga session can last 45 to 90 minutes, but 10 minutes to 20 minutes can be beneficial if you do it 3 times a week. And then yoga can obviously be modified as needed. So if somebody isn't as mobile, if they aren't able to walk around, or if they're chair bound, they can still do yoga in a wheelchair and still get benefits from that. And it can also improve your mobility and your flexibility. Things to consider: yoga does not replace medical treatment. It is not covered by your health insurance, and to see your doctor to find out if yoga is right for you. Here's my handout that I would give, like I said, to a pain clinic for patients that are seeking assistance for chronic pain. So this would give patients the tools to continue to move, to stretch, to become more flexible. And it's not necessarily going to fix the problem of the opioid crisis, but it could definitely help to give them tools to have an alternative as a non-pharmacological intervention. And it can also give them a tool, if they're already addicted to opioids, to help them to give them an alternative. I think that if they decided to choose yoga, following up with the doctor at a pain clinic, and then the doctor evaluating if yoga had worked for them, if they have any barriers for transportation, to see if any of those barriers could be helped with to getting to the classes, if it's something they were interested in doing, or if they found that it was something to be helpful for them. I'm not sure that a lot of cultures would accept a holistic approach to the pain relief. I feel like some cultures would, they would think that medication would be more of a more efficient treatment than yoga. But I think educating them in how yoga works and just more of a holistic approach as to how that would be a better approach to pain management, could potentially bridge the gap between misunderstanding of non-pharmacological interventions. A lot of people nowadays think that medication is the only way to relieve pain, and I think educating patients on other alternatives may definitely benefit the opioid crisis in helping to overcome that.